Adverse events in long-term care are a problem. CMS knows this and is focusing on addressing this issue. Surveyors have a new tool that was developed for just this purpose. It's time to get ready for it. In 2014, the Office of Inspector General did an adverse drug event study and found that 37% of patients in long-term care settings had adverse drug events during the first 35 days of stay. Once the report was published, CMS issued a memo in July of 2015 advising state surveyors of these findings and providing an adverse event trigger tool for use in evaluating facilities for these occurrences. The tool is supposed to help surveyors determine if adverse drug events have occurred, might occur in the future, as well as document if the facility has adequate programs and training in place to keep them from happening. That could be quite a challenge. This is why we say this. Take a look at the table here. It's one taken from the CMS Trigger Tool. It's organized by drug classes and evaluates risk factors, signs and symptoms of adverse drug events, evidence of clinical interventions in the past that might suggest an ADE occurred, and questions to ask your staff. In this case, opioid use is being evaluated. Notice that the triggers are common side effects. Now that's scary. And of course, if the patient was admitted to the hospital, that suggests something bad happened, whether it really did or not. One more problem to solve with all the others. The Trigger tool addresses all classes of high-risk medications, including antipsychotics, anticholinergics, diabetic medications, statins, heart medications, pain medications, you name it. But we can help you. We bring a full clinical support program that's paid for by Medicare and guided by our Chief Medical Officer, Dr. Sean Phelps. His experience as a Special Forces physician enables us to provide real boots-on-the-ground support to your clinical team. He is a really brilliant clinician. Our program provides support and training for your pharmacy, nursing staff, and physicians. The Pro-GeneX solution provides a proprietary facility triage report that identifies those patients that are at the highest risk for an adverse drug event and those that even have higher potential risk due to their genetics. This allows you to focus attention on the highest risks first for the greatest possible outcome. Not only does the report address the adverse drug event risk group, but also those that are the highest risk for serotonin toxicity. And this can look just like an adverse drug event in itself. It also identifies patients with higher fall risk and even those that are more likely to experience strong drug side effects, which is another item that can look like an adverse event. Your QA team will love this, and your CFO will be happy too. To set up a brief presentation and learn more about our programs, contact us here.